ER nurses of Reddit. How often are "one more minute and I'd be gone" stories exaggerated? As an internal medicine doctor, I can tell you sometimes those stories are completely accurate. Had a guy in his 40s come in complaining he'd felt weird in the chest all day. Athletic build, going through a divorce, obviously stressed out. His EKG looked normal, and honestly, I see chest pain complaints constantly. Usually it's heartburn, anxiety, pulled muscle, nothing serious. I was literally about to send him home with some antacids, but something felt off about him. Call it intuition, but I decided to send him to the emergency department instead. He declined a wheelchair, said he'd walk the 200 feet over there. An hour later, I checked his chart and saw a code blue note. Turns out he was having a mild heart attack, and while the ED doc was explaining his blood work results, he went into full cardiac arrest right there in front of them. Luckily, having your heart stop in an emergency room with a cardiologist standing right there is pretty much the best case scenario. They got him back immediately. When I saw him a week later, he mentioned he'd almost stopped for lunch at a sandwich shop before going to the ED but decided against it. If he'd waited even 15 minutes, he would have had his arrest in a restaurant instead of a medical facility. 20 years of practice, and that's still my closest call.